Now let's look at some people handling equipment. Handling equipment is often used to transfer people safely. It reduces the weight of the load you are working with. Handling equipment includes handling belts, which fit around people's waists. These effectively put handles on a person, making them easier to hold.
Stand. Yeah, that's it. Bringing your hand up, okay. And then now we're going to just walk across. Okay. Just carefully and slowly, we're going to walk.
Slide sheets are placed beneath parts of the body to reposition a person.
We're going to bring you over this way, Brian. And we're going to put something under your heels, Brian.
They are mostly used to move a person in bed.
Lift your head and look at your tummy. Okay, ready, steady, slide. Okay, that's good. Okay, now you can rest your head back. Carefully. Right, Brian, good at lifting your head and looking at your tummy. Ready, steady, up we go.
Lifting hoists transfer a person from one place to another. For example, from a chair to a bed. Each hoist has a maximum lifting weight. Know the safe weight limit of the hoist you are using and always check that that person you want to lift is under the weight limit. A standing hoist helps a person to stand from a sitting position or sit from a standing position. The person being moved with the standing hoist needs to have some level of ability. A framed turning platform helps people to turn around and reposition themselves. It is used for people who can stand but not step. Transfer boards enable people to move themselves from one surface to another. This is a good example of equipment that is used to maintain a person's independence. A tilting chair also maintains a person's independence. It tilts forwards, allowing the person to stand. In some chairs, just the seat cushion tilts. You're probably using a lot of this equipment in your work already. Remember, all equipment can be dangerous if it's not used correctly. Training is vital. Also, you must always check the equipment before you use it and report any faults. Now let's look at safe handling techniques in general. You will have a copy of Handling People Safely Approved Techniques. This manual is based on the ACC guidelines. It gives you a step-by-step guide of the techniques for the safe handling of people. I asked Anne what support workers kaiawhina need to do to prepare themselves before handling a person.
Well, I think preparing themselves, they need first of all to check their patient's care or transfer plan so that they know exactly what they're going to be doing. The next thing they need to be doing is planning the environment that they work in to make sure they've got enough space so they can actually get in the correct posture. Perhaps looking around at the floor surface, make sure there's nothing they can trip over or there's no slippery surfaces. So they need to prepare the environment. And then they need to plan and check the equipment they're going to be using so that they're really well prepared for the task. And then when they do the task, they need to think about their posture.
Remember to use the light principles to think about the load, which is the person.
As regards the person that they're moving, it's mainly giving a really good explanation of what they're going to do.
Ready, steady, slide, and then you'll be over facing the window.
Giving the person time to respond to that, and if they can move themselves, that they're able to, and perhaps demonstrating the equipment if the person hasn't seen the equipment before, so that makes the person more confident about what's going to happen.
You can see that communication is important during a transfer. It's especially important when you are working with another support worker kaiawhina. Use clear prompts. For example, ready, steady, move, and ready, steady, stand. Make sure the action happens on the word move or stand.
Okay, ready, steady, slide. Okay, that's good. Okay, now you can rest.
Remember to prepare yourself and prepare the person you are transferring before you move them. Your communication skills are an important part of safe handling. Well, now let's look at some of the techniques you'll be using to transfer the people you support. I asked Anne, why is it so important to use the correct techniques when you transfer people?
It's a safety issue really. The correct technique will protect both the support worker and the person they're supporting and protect them from injury.
And how important is it to match the correct technique to the person who's being transferred?
You do need to assess the situation and match the technique to the person's ability. For example, when you use the standing hoist, you need to make sure that the person is able to take weight through their legs. They need to be able to cooperate, balance and control their upper body. As well, they need to be able to place their feet on the foot plates, brace their knees against the knee pad and be able to grasp the handrail. If they couldn't do this, then they would need to use a different piece of equipment and a different technique.
Tell me, why are there so many types of equipment like transfer boards, slide sheets and machinery to help with transferring people?
Well, the equipment cuts down the amount of weight that the support workers have to take. And again, it comes back to protecting the support workers and the people they transfer from injury.
Now, to support a person from standing to sitting, what should a support worker kaiawhina do?
Stand to the side or behind the person. One palm on the person's shoulder, the other on their mid-back. Ask the person to support themselves by placing a hand on the armrest and just talk them through it.
How can support workers kaiawhina support a person with little strength and movement go from lying down to sitting up at the edge of their bed?
When the person's been rolled onto their side, the lead support worker who's standing at the person's chest level pushes down through the person's hip. If there's another support worker available, they can help the person bringing their legs over.
That's okay. That's probably the best.
And preventing falls is far more effective than dealing with the after effects. But when falls do occur, what can support workers kaiawhina do?
If someone's fallen, you need to carefully assess the situation to avoid injury to yourself and to the person that you are supporting. You can either coach the person to get themselves up if they're able to, or you can use a powered device like a hoist or a lifting cushion if they're unable to assist themselves. To use a hoist, you need to place the sling under the person after you've done the initial assessment. To do this, you just roll the person onto their side, lay the rolled up sling beside them. Now roll them back so they're half on the sling, roll the person again and unroll the rest of the sling, rolling the person onto their back to finish. Check that the person is in the middle of the sling and that the leg supports are positioned around their mid-thigh. They're ready for the hoist now. Bring the hoist in. Support workers usually bend the person's knees and position one of the hoist legs underneath. From here, it's just a matter of lowering the boom as low as you can. You bring the nose of the boom just above the person's chest and secure the straps to attach the sling. The hoist is ready to be raised and the person positioned. Remember to remove the sling as soon as you can because we don't like to leave the person in the sling for a long time.
Just carefully tap it out.
Remember, your manual handling trainer will show you the techniques for handling people safely, and they will supervise you while you practice until you can do the techniques safely. To assist your learning, let's summarise the main points. Safe handling is moving people and objects in a way that reduces the risk of injuries. You work in an occupation that puts you at risk of injury to your neck, back, shoulders and knees. These injuries can be caused by sudden forceful movement or by constant working with poor posture. Get into the habit of assessing risks and planning safe transfers using the LIGHT principles. LIGHT stands for load, individual, task and environment. Exercise for flexibility and strength and maintaining a healthy posture are part of looking after yourself. You can reduce your risk of injury if you have regular education, training and updates on safe handling. Use the correct techniques every time you handle a person or an object. You must always check the equipment before you use it and report any faults. Prepare yourself and prepare the person you are transferring before you move them. Your manual handling trainer will show you the techniques for handling people safely. They will supervise you until you can do the techniques safely. Well, I hope now you understand how to handle people and objects safely in your job as a support worker kaiawhina.